This is our group presentation on Ayurvedic alternative health therapy. I'm Allison.
And I'm Megan.
I'm Christina.
I'm Rachel. And we're going to show you our healthcare model that we created and also speak to the specific integrative therapy of Ayurvedic medicine. And we are going to build our healthcare model as we present it because that is how we feel the healthcare system kind of evolved over time throughout history. Hi, so we will begin with Canada's healthcare system. It is structured to meet the healthcare needs of Canadians through universal coverage for medically necessary healthcare services on the basis of need rather than the ability to pay. In order to make this work, the healthcare system is publicly funded and the organizations involved include federal, provincial, and territorial levels of government. The Canada Health Act is a major component of Canada's healthcare system and outlines important value-laden principles that aim to provide healthcare through public administration, which is the plan must be administered and operated on a non-profit basis by an accounting provincial authority and subject to audits. Comprehensiveness, the insurance plans must cover health services provided by hospitals, medical practitioners, or dentists to ensure comprehensiveness of coverage. Universality, ensured healthcare for all Canadians unless people were covered under other provincial or federal plans. Accessibility, the plan needs to provide reasonable access to needed insured services and not be impeded by user charges. And lastly, portability, to ensure health coverage when individuals move from one province or territory to another within a 3-month wait. One of the most common ways healthcare is provided in Canada is through primary healthcare, which Allison will now speak to.
According to the Canadian Nurses Association, the primary health care approach focuses on promoting health and preventing illness. This approach means being attentive to and addressing the many factors in social, economic, and physical environments that affect health, from diet, income, and schooling to relationship, housing, workplace, culture, and environmental quality. In addition, the primary health care approach places citizens and patients on an equal footing with healthcare professionals with respect to decision-making about health issues. The 5 main principles of primary healthcare include accessibility, which is a continuing and organized supply of essential health services is available to all people with no unreasonable geographic or financial barriers. Public participation, so individuals and communities have the right and responsibility to be active partners in making decisions about their health and the health of their community. Health promotion, the process of enabling people to increase overall control and improve their overall health. Appropriate technology. This includes method of care, service delivery, procedures, and equipment that are socially acceptable and affordable. Intersectoral collaboration is commitment from all sectors, including government, community, and health, is essential for meaningful action on determinants of health. And now Christine is going to talk about integrative health therapies.
So I'm going to be talking about integrative therapies. Integrative therapies emphasizes the importance of the patient and the practitioner relationship being the center of everything instead of the disease. It focuses on person and environment, not as separate entities. It focuses on the least invasive and least toxic methods to heal the body. Some of the different types of integrative healing are Ayurvedic medicine, which we'll be talking in depth later on, Chinese medicine, herbal medicine, and along with yoga and massage therapy. We chose to place integrative therapies close to the patient because when it comes to integrative therapies, the patient has a strong active role in which the practitioner guides the patient through. And now Rachel will be talking about the assumptions of our model.
We have developed our own underlying assumptions that ties the model together. The patient is a fully active participant in their health care, and the nurse is able to work within their full scope to assist the patient in their care through knowledge and application of the Canada's healthcare system, primary healthcare, and integrative therapies. Also, we have chosen other underlying assumptions such as Number 1, the energy field serves as a blueprint or template, and each person is characterized by a unique pattern of vibration, energetically connected and creating an energy field around the person.
Number 2, when in a state of health, life energy flows freely through the person in a balanced, harmonious, symmetrical pattern. When in a state of illness, there is imbalance, blockage, or stagnation of energy flow. Number 3, life energy flows the intent to heal. Healers can facilitate energy flow for restoration of harmony and order. Number 4, the client and the healer are interconnected and connected to the universal energy field. Now we're going to focus on the integrative therapy we have selected. Ayurvedic medicine is one of the oldest medical systems. It first originated in India more than 10,000 years ago. It is named for the Sanskrit word Ayurveda, meaning the science of life. Ayurvedic medicine is entirely holistic. It strives to create harmony between the body, mind, and spirit, maintaining that this balance prevents illness, contributes to a long and healthy lifestyle. Ayurveda theory evolved from a deep understanding of creation. The great rishis or seers of ancient India came to understand creation through deep meditation and other spiritual practices. This knowledge was passed down through generations with songs and chants, and then it was written down in the oldest books now existing on the planet, also known as Vedas. In Ayurvedic philosophy, people, their health, and the universe are all thought to be related. It is believed that health problems can result when these relationships are out of balance. There are 5 elements that combine in the body. These 5 elements are earth, fire, water, air, and ether. These elements come together in the body to form 3 doshas, which control how the body works. Now focusing more on the 5 elements, earth represents the solid state of matter and along with water is responsible for the physical constitution of the body. Bones, teeth, and tissues are considered earth elements. Water represents the liquid state of matter and indicates change and instability. Water is responsible for the fluid metabolism in the body, and so blood, lymph, and other fluids are considered as water elements. The element of fire represents the form without substance and has the power to transfer the state of any substance. In the body, it is responsible for digestion and perception. Wind or air represents the gaseous state of matter and indicates mobility and dynamic. In the body, the wind element is responsible for the respiratory system and necessary for all energy transfers, as air is the key element needed for fire to burn. Ether represents the space in which everything takes place. In the body, it relates to all hollow or empty spaces in the body like channels and pores and the ears that perceive sound. Now focusing on the tridoshas, or also known as doshas, they are responsible for all functions of the body and mind. We have all 3 doshas in our body, just in different proportions. So each dosha is unique to each person, just like a fingerprint. Each dosha is made up of 1 or 2 of the basic elements. The balance between the 3 doshas leads to health and a sense of well-being. Now focusing on each one, so vata, which means that which moves, is made up of ether and wind, which is the energy that controls bodily functions associated with motion, including blood circulation, breathing, blinking, and a beating heart. Pitta means to shine, which includes fire and water, is the energy that controls the body's metabolic systems, such as digestion, absorption, nutrition, and the body's temperature. Lastly, kapha is a term meaning that which holds things together, which is made up of earth and water. It is the energy that controls growth in the body. It supplies water to all body parts, moisturizes skin, and maintains the immune system. Imbalances may be caused by an unhealthy lifestyle or diet, too much or too little mental exertion, or not being properly protected from the physical environment. Ayurvedic medicine believes that once balance is achieved between the 3 doshas, the body will no longer be in disharmony, and the symptoms will dissipate and healing will occur. Next is Megan, and she'll be focusing on the research portion.
So the research on Ayurveda outlines the existing differences between Ayurvedic and biomedical practices, but it also explores the ability to combine both in order to provide more efficient and sustainable healthcare. In relation to disease and the person, one important aspect in the research looks at the correlations between the Ayurvedic and modern parameters for disease susceptibility and prevalence. However, Ayurvedic physiology and pathology have not been explained in terms of modern biochemistry and cell biology. So, establishing links between Ayurveda and modern medicine can provide novel insights for modern personalized medicine. It is important to mention Ayurvedic practitioners are more interested in what kind of person has the disease rather than what kind of disease the person has. Although Ayurveda and biomedical sciences differ, it is possible and necessary to integrate the two in order to create a new and improved model of healthcare. While there are efforts being made in further recognizing Ayurvedic medicine, it still lags much behind conventional medicine with respect to scientific research and publications. Now, Christine will speak towards the practice of Ayurvedic medicine.
So I'm going to be talking about how Ayurvedic medicine is being practiced today. So Ayurvedic medicine is being used for many different types of diseases, disorders, and imbalances. So one thing that it's being used for is actually to treat postpartum depression in mothers. One article I found, the author goes on to talk about how the doctor would examine, diagnose, and then create a plan specifically for that patient. Each individual would have a different plan to restore mind, body, and spirit that is related to their specific etiology, pathogenesis, and symptoms. Some examples of treatment are a daily oil massage to counteract the dosha vata, which Rachel already talked about today, which is the element of lightness, dryness, cold, and roughness, along with specific types of food prescriptions like only warm food, getting regular amounts of sleep into a routine of early mornings and early nights. Herbal remedies such as cinnamon, olive oil, and nutmeg to balance hormones within the brain and calm the brain, as the article put it. Ayurvedic medicine is also being used to treat diabetes mellitus, and it is also being used and researched on how to treat cancer. So this article that I found talks about the herbal decoctions are being used consisting of multiple herbs, each possessing tremendous potential for a cancer cure, are commonly used in Ayurveda. These formulations are reported to work on multiple biochemical pathways and are capable of influencing several organ systems simultaneously. Ayurvedic medicine is also being used for treatment of rheumatoid arthritis. So now Allison will be talking about how Ayurvedic medicine connects to our model.
So now we're going to look at how Ayurvedic medicine applies to primary health care. So the main goal of Ayurvedic medicine is health promotion and illness prevention. Ayurvedic medicine incorporates several principles from primary health care, those being health promotion, public participation, and appropriate use of technology. To describe on those more, individuals should be involved in the decisions about their health and have input into the choices of their treatment, which is a huge component of Ayurvedic medicine. Also, Ayurveda uses the power of observation rather than using equipment and laboratory tests to diagnose disease and illnesses. Diagnosis is based on observation and questioning the patient to get a full family history. Now we're going to look at the determinants of health that relate to Ayurvedic medicine. So the first one that we selected was socioeconomic status. So research has identified that the majority of individuals who use alternative health therapies are those who are highly educated and have a higher socioeconomic status. Those with higher educational background are able to make informed decisions regarding alternative health therapies. Additionally, alternative health therapies can be expensive and is normally not covered through insurance health care plans, leading those with higher economic statuses are more likely to practice these therapies. Physical environment is another determinant of health that we selected that's related to Ayurvedic alternative health therapy. So physical environment plays a huge role in this alternative health therapy, as the main principle or belief behind this therapy is the balance one creates and maintains with the environment. The focus of healing and balance surrounds the 5 elements of Mother Nature, which include earth, water, fire, air, and ether. When the balance between the two is shifted, illness is present, thus identifying the importance of maintaining balance between the individual and their physical surroundings. Ayurveda views illness as a disharmony with one's environment and aims to balance the mind, body, spirit through the use of highly personalized approach. Personal health practices. So this alternative therapy focuses on the personal health practices one engages in order to promote health and prevent illness. focusing on the importance of diet, exercise, such as yoga, and lifestyle enhancing health. Individualized health promoting activities are recommended depending on the individual symptoms and disease that they are diagnosed with. Ayurveda attempts to influence lifestyle in order to maintain health in a healthy person and heal the disease of an unhealthy person by restoring balance.
So now I'm going to talk about social support networks and how it relates to Ayurvedic medicine. So Ayurvedic also emphasizes the interdependence between the quality of life of one's health and their social life. It also emphasizes talking with people about things and not keeping it in, which you need a big social support network for that. Now I'm going to talk about spirituality as a determinant of health. Ayurvedic medicine believes illness is a disharmony of one or more of an individual's mind, body, and spirit. The ultimate purpose of Ayurveda is to know and realize the Creator and to express the divinity in one's daily life. Because one of the main core principles is harmony and balance, individuals who practice Ayurvedic medicine believe that knowing the Creator is the ultimate purpose to life. Ayurvedic medicine also concentrates on the elements that make up the universe: earth, water, fire, and ether, as was discussed earlier. This shows how Ayurvedic medicine incorporates the spirituality of Mother Nature into the healing practice. Now Megan and Rachel will be talking about the significance of present healthcare practices.
The existing knowledge of Ayurveda and ethnic medicines are being validated through newer guidelines of standardization, manufacture, quality control, and modern techniques. Considering the emphasis on health promotion and illness prevention in today's healthcare system, Ayurvedic medicine certainly has a place in present healthcare practices. Seeing as how nurses are at the forefront of patient care, it is important to include this form of integrative therapy in nursing education, as the combination of Eastern and Western perspectives offers nurses and other healthcare providers some refreshing new integrated approaches and possibilities for understanding health, illness, and people care needs to provide culturally congruent healthcare services. An available option for nurses to explore in terms of educational programs specific to Ayurveda, such as the Advanced Diploma in Ayurvedic Medicine offered by the College of Ayurveda. However, the Royal College of Nursing advises that nurses contemplating integrating complementary and alternative therapy in their practice need to discuss the issue with their colleagues to ensure that the therapies they offer are responsive to clinical needs, conform to principles of clinical governance, and meet the legal requirements of their employing organization.
Now, looking at patient safety, just like other complementary therapies, Ayurvedic medicine may be taken up by patients who are also accessing conventional care. This can lead to contraindications and potential for adverse outcomes or side effects. This is a concern when therapies are being used incorrectly, are being abused, or prescribed by unqualified practitioners. Also, some patients may be shy to disclose other treatments they're using or may think that it is not important information to provide. As nurses, we need a full picture of both conventional and complementary practices that patients are using to effectively manage their care. To ensure patient safety is maintained, it is necessary to initiate the conversation as part of the assessment process. Asking a simple open question like, "Are you doing anything else for this condition?" gives the patient the opportunity to discuss about the use of other therapies. It is important for nurses to exercise sensitivity and non-judgmental approaches when obtaining information about the use of alternative therapies, and also fostering an open and safe environment to share information. Next, Allison will be talking more about the strengths.
Nurses can strengthen their practice by considering the following questions in regards to the primary healthcare principles. For accessibility, what issues affect the ability of your clients to access your services? Is it the hours, transportation, cultural, economic factors? How can your services be made more accessible? Health promotion. What are the effects of social, economic, and environmental factors on the health of your clients? Did you take these factors into account when you developed their interventions? Interdisciplinary collaboration. Do you work as a team with health professionals of other disciplines? What could be done to make this relationship more effective? Use of appropriate skills and technology. Are the skills of different health and social service professionals used in the most effective way to support your clients? Public participation. Does the community you work with have input into the kind of programs you do or the way in which they are delivered? Next is going to be Megan with our summary.
This oral presentation has demonstrated how our healthcare model combines present healthcare practices with the integrative therapy of Ayurvedic medicine in the treatment of the patient and identifies the valuable relationship between patient and practitioner. Ayurvedic medicine has increased in popularity on an international level, and while there has been documented research on this healing therapy, there is still ample opportunity for further research.
Thank you for listening to our presentation, and we hope you enjoyed it.